Hello everyone, I, Niharika Sapra, volunteer car group, welcome you all. I welcome our respected speaker, Chairman and CEO Dr. Kavita Ma'am, car volunteers and all attendees to car webinar. I would like to take the opportunity to introduce car homeopathic study group to all of you. Car Homeopathic Study Group Pro Bono was organized and founded by homeopath and humanitarian Dr. Kavita Kokunur, President and CEO of Kavita Holistic Approach KA on May 5th, 2020. This study group is intended to be an offering from Dr. Kavita to homeopaths around the globe, sharing goodwill and solid clinical work within the classical model for foundational principles for CA. CA's mission and vision are very unique to inspire young homeopaths, mentor, provide excellence for educational purposes using holistic approach via webinars which are based on principles of classical homeopathy and provide professional continuing education to homeopathic credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. Dr. Kavita is a member of Kelvin Friendly Foundation, a non-profit organization that helps serve poor people in greater needs in India. She is nationally board certified by Council for Homeopathic Certification, CHC, and ACHENA CPD provider and serves as the associate editor for Homeopathic Heritage magazine. She is a NASH mentor for North American Society of Homeopaths and lifetime member of NCH National Center for Homeopathy. She is the recipient of Martha Ullman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Lingaraju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. Tana Telugu Association of North America, a prestigious organization, honored and awarded her for selfless homeopathic and humanitarian services at Ladies' Night Out on October 2022, Michigan. Also, Dr. Kavita received the prestigious Legendary Homeopath Award with joint hands of Honorable Health Minister Dr. Dhan Singh Rawat, Senior MLA Mr. Harbhajan Singh Chima, ex-director of homeopathy, Government of Uttarakhand, and chairman of HomeoCure and Research Institute during National Homeopathic Seminar, Homeopathy, the Future Medicine at Kashipur on 21st August 2022. Dr. Rajneesh Sharma, CA Advisor, and Dr. Shweta Singh, CA Chief Administration. CA team were also recognized and presented with Legendary Homeopath Award at the ceremony. We are proud to announce that Dr. Kavita was honored as the Woman of the Year 2023 from prestigious organization NATA, North American Telugu Association USA. Dr. Kavita was also honored by renowned DTA Executive Committee on Mother's Day at Michigan, USA with DTA Community Service Award 2023. She also received the Lifetime Achievement Award 2024 by HomeoCure and Research Institute Director Dr. Rajneesh Kumar Sharma, Ka Homeopathic Study Group, Calvin Friendly Foundation, in presence of Chief Guest Dr. Shripad Hejre. Best wishes from Homeo 360. We are extremely happy and proud that we celebrate 14 years of her book, Beyond the Limits, A Challenge to Prove Oneself, and her second book, A Dose of Spirituality with Kavita, has also completed 3 years on 22nd Jan 2025, which was launched in presence of honorable guests speakers of American Institute of Homeopathy President Dr. Alice Baker and Council for Homeopathy CHC President Dr. Sheetal Tiwari at our KHA webinar. At KHA's second annual celebration, our honorable guest speaker, Dr. Jawahar Shah, Chairman of Enlightenment Education, launched its audio version and hard copy. We have donated over $1500 to 10 to 15 charities within 1 year, which we have also listed on the website. As of now, we have nearly 600 plus recordings on professional webinars related to homeopathy, health, and other related topics and inspirational talks available on our YouTube channel, Kavita Kukunur. This webinar is moderated by me and Dr. Kavita ma'am. It's being recording as we speak. We will take questions at the end of the webinar, and we will also post a jot form in the Zoom webinar chat towards the end. Everyone is requested to kindly mute yourself, and if possible, you may keep your videos on or off depending on your connectivity. The jot form is to be filled, linked to the chat in the Zoom, which will give you your certificates via email. Now, before starting our scientific session, I would like to read the disclaimer and code of ethics. Disclaimer: all KHA Homeo Study Group webinars are for educational purposes only and not intended to diagnose or treat a disease. Listeners can benefit with the information shared at the webinars. The opinion expressed by speakers, moderators, and attendees are part of educational experience and do not necessarily represent the position of Kavita Holistic Approach, KHA or KHA Homeopathic Study Group Pro Bono. Ethics and benefits. To be a KHA speaker, one needs at least 1 to 2 months active volunteering. Only KHA speakers' themes are promoted in newsletters and webinars. KHA provides volunteering for 2 to 12 months, respects and inspires volunteers to grow. Active volunteers will be promoted through our website, social media, and added to WhatsApp group. Articles of volunteers will be posted on KHA website and newsletters and will be sent for publications at other journals too. Volunteers and speakers are eligible for prestigious KHA annual awards. Volunteers are eligible for KHA inspirational talks. Volunteers are eligible for case discussions. KHA promotes homeopathic organizations as well as their mega events. KHA promotes great work of speakers through their book reviews. Honorable guests may propose their future courses or events after the webinar. KHA maintains a healthy and happy environment, so keeps only like-minded folks. KHA requests everyone to maintain the confidentiality of the group. You may visit us at www.kavitakahomeo.com. Over to you, ma'am.
Thank you so much, Dr. Niharika. She is our enthusiastic volunteer. Hello, everyone. Welcome to KHA Homeopathy Study Group webinar. Good morning, good afternoon, and good evening. So nice to see many of you from different countries and different parts zones. Before we start our webinar, we always thank Universe for giving us this great opportunity. Today, December 14, 2025, we have our honorable speaker, Dr. Shekhar Algundgi, on very interesting topic, artistic case taking with assorted cases. Thank you so much, Dr. Shekhar, for honoring our platform, and no introduction is needed for Dr. Algundgi. For those who do not know him, he is a renowned distinguished Indian homeopath, educator, author, and philanthropist. With a career spanning over 3 decades, he has pioneered advancements in modern homeopathic practices by integrating traditional principles with contemporary healthcare methodologies. As the founder of Swara Homeo Clinic and Gurukul and the co-director of Swara Homeo Charitable Clinic, Dr. Algundgi has played a pivotal role in making homeopathic healthcare more accessible. His contributions extend to global advocacy for homeopathy and the mentorship of aspiring practitioners through innovative educational programs. The Man on Mission campaign aim is to spread the efficacy of science and art of homeopathy in young budding homeopaths as well as in society as part of an awareness program. He has received several countless awards. To name few, Dr. Henneman Award by Urethral Homeo Research and Awareness Trust, the Great Indian Doctor of the Year 2024 by the Wings of Fire Indian Business Awards, Swami Vivekananda Philosopher Award by Well-Read Foundation as an excellent doctor in the medical field, Bharat Gaurav Ratna Shri Saman Award for remarkable role in teaching, International Excellence Award 2024 by Exceller Books for Research and Development for research-based writing, London Book of World Records for spreading the homeopathic science to students globally through the innovative concept of Swara Homeo Gurukul. There are so many, and I will just take few more. National Educator Award 2024 in the field of medical service and education by Radiant Talent Book of Record. Mother Teresa Social Reformer Award by Well-Read Foundation as an excellent doctor in the medical field. Global Prestigious Award by Worthy Wellness Foundation for originating the Man on Mission campaign. Rabindranath Tagore Global Peace Award by European Council for Research and Development for originating the Man on Mission campaign. International Honorable Award by Asian Council for Education and Research. Mahatma Gandhi Ionic Peace Award by Well-Read Foundation as an excellent doctor in the medical field. Golden Globe Oscar Awards 2024 by J.J. Crown for author of the book Case Taking. Icon of Nation Award 2024 by World 7 Wonders Radiant Talent Book of Record. As an iconic teacher in the field of homeopathic system of medicine. International Global Award 2024 by Om Gagangiri World Foundation. Bharat Seva Puraskar 2024 for social activism. The Man on Mission campaign, educating society about homeopathy. Best Book of the Year Award by TAOI Awards for the book Case Taking, the Art of Connection, Communication and Conversation. I can go on and on and on. And for more information, visit www.swarahomeo.com. And we are so fortunate to do book review of Dr. Shekhar Algundgi's Case Taking, the Art of Connection, Communication and Conversation. A feeling you get that you are right in front of Dr. Samuel Hahnemann, and he's explaining the art of case taking, and a book that everyone must read to become a better human being. And we will also love to hear upcoming events about Swara Homeo Clinic. And without delay, we warm welcome you, Dr. Shekhar Algundgi, to our webinar.
So first of all, let me thank Kavita Holistic Approach platform for giving me this opportunity today. Well, such good activities are needed in this hour of life for the simple reason that we all are into a rat race. We don't even know what we are exactly doing. And many of them, I ask them, are you really going through life or are you really growing in life? And when you say that I'm growing in life, the idea is experiencing every situations of life that come across. But today's gadget world has made us so nuclear. Apart from nuclear family, we are nuclear in the nuclear family. Because no one is there to talk to each other. And many a times I even asked my patients last night, what did you have for dinner? They have to scratch their head and say, what did I have? What did I have? How will you know? Because you're so damn busy on the mobile that you don't even know what food is served to you. And if I do not see the food, smell the food, taste the food, how will the enzymes really act? And why should they act? Because the mouth is not watering, there is no salivation because you have not seen it, you do not feel the texture of it. And when the special senses are not really synchronized with each other, we are not growing in life. We are simply going through life. Just to fill the stomach, I've had something. And half of the time it is traffic jam over here. The food is held over here and we're watching the mobile. Such is the situation in today's life. And therefore, actually this topic should be done in 3 or 4 sittings if I have to be very frank with everybody. The reason behind it is because this is something called as the open picture at the opening stage of a conversation. So the whole idea is the 3C, which are very, very important. First is the idea of connecting. If I am not able to connect to you all, nothing will make sense to you all. And once the connection is set up between me and the other person, whomsoever I'm seeing or talking, only then the communication happens. And the communication can happen when there is a common platform. When both are talking on one particular platform, on one particular issue or situation or incidents. And when there is give and take, what we call it as a dialogue, only then it ends up into a proper conversation. So it is connect, communicate, and converse. And so when we are taking cases, we are trying to connect to the person in front of us. And therefore, our interests are put aside. We are going through their interests. We are going through their situations. We are going through what incidences they have faced, what they really liked, what they disliked, what aggravated them, what gives them relief. And this art of communication can only be set up when we are inquisitive. I use the word when we are inquisitive in knowing that person. So it is not the situation that that person has faced. It is not about the incidents that the person has gone through, but it is he or she who has gone through that situation or that incidents. What has triggered in that person through that situation? So the situation or the incidents is just the media. What is happening to that person is the picture. And through this media, we see the picture. And that picture is something that that individual is going through. It is not the same as your own picture. And therefore, it is called as individualization. And when we are seeing that picture, the questions that come is what is triggering? What is happening? Since when is it happening? Who is in that situation, in that incidence that is of utmost importance that has caused this triggering factor? In other words, what aggravates it? What ameliorates it? And what is the pace of this picture that that individual is facing? In other words, the miasm. So all these W's beautifully gives us the idea about what is that person going through that media of that situation or an incidence. And so every individual will come and tell you some other incidents. Oh, you see, doc, my children are not listening. Oh, you see, doc, my spouse is not listening. Oh, my boss is doing this particular harassment towards me. These are simply media, a triggering factor. And therefore, every individual goes through some or the other way in this particular triggering factor. And what we do humanly, we are interested into this situation. We are interested in this incidence. And we fail to realize the picture that the person is going through, which is of utmost importance. And so when I formulated all these W's in the book called Case Taking, the Art of Connection, Communication and Conversation, the idea of W's explores to bring out this picture, what Hahnemann says, tracing the true picture of the disease. And what is the picture? The picture is nothing else but what is that person going through. What all is happening to him or her from head to toe. What is it that the person is showing you the utmost sensitive part in that entire scenario of the triggering factor. And therefore, these are something that we need to understand through cases. And many of them are practitioners, so I don't want to get into the theory because time is short. So I would directly show you the case, and through the case, I would like to make you all understand where am I seeing and what would you all have seen. Because humanly, we can see all sorts of sorrows and sufferings and happiness and joy and thrill and all these things, needs and desires and everything. Humanly, it is very common and it is understandable. But what we fail to see is what is that person going through in that suffering or in that joy or in that happiness or in that particular moment of time of his or her emotions. Because emotions are the light. And the brightness of that emotion is what the person is going through in that emotion. So we have got to see the light and not the lamp. The lamp is there to give the light. So emotions are there with every human being. But what is that person going through is the light. And if you understand this aspect, you see, that is where the growth of an individual happens. That is how we are growing. When we are having some beautiful dish that has been prepared, when we are seeing the flavor of it, wow, the texture of it, the feel of it, the taste of it. When we try to analyze what's the spices that has been more or less or what it is, that is literally understanding that you are enjoying the meal. Rather than simply hurriedly you are heating and the plate is over, go keep it in the wash basin, wash your hand and move. What you had, God knows. What was the content, God knows. So try and understand when we are taking cases, we need to understand the ingredients rather than just the title of that particular situation. And with this, I hereby show you a case so that we can understand how we can see what is needed to be seen in a given individual.
Tell me all your problems.
Yeah. So right now I'm supposed to describe only my current issue, right? Whatever I'm.
Whatever comes to you, you yourself, your complaints, your life story.
Right now, should I have to tell you only my complaints? And I tell him, whatever comes to you, you yourself, your complaints, your life story, wherever. And this is exactly what I'm right now doing for the 19, 20, 21, the retreat, to make people understand, live the way you want to live. There is nobody to see here. There is no boss for y'all. There is no society. There is no neighbor over here. You are the only free soul in this entire 3 days of this retreat. The idea of setting oneself without boundaries, our societal boundary, our positional boundary, our image boundary, all these restrict us. And therefore, we are living a life with a set pattern. This is how should I sit, this is the way how should I talk, this is the way I should say good morning, this is the way I should obey the orders. This itself is creating a boundary. And when you're restricted in such a boundary, then begins a stage called as frustration. And with that frustration, then you vent out all your emotions. And when you vent out all those emotions, at certain point of time, you start imagining yourself. And that is the time, mind well, my friends, the vital force is now limited and restricted. And therefore, the vital force starts abnormally showing its expressions in the form of signs and symptoms. And what we are trying to trace out is, let's see this vital force. Let's see this person, who this person is. What are the problems with this person? How is he looking at his problems? What is the thing that is exactly bothering him? It may not be the situation. It may not necessarily be anything in his life which he's day-to-day facing, but it is something beyond that. That where his vital force is caged and showing an expressions through verbal communications. His internal pattern is expressed through verbal communications. And that is how we all begin with some sort of dispute by verbal communication, transform further through body expressions, and further transformed into sounds by screaming, shouting, yelling, all these things, right?
Reason why basically consulting you is basically see, for the last about 2 to 3 years I've been having repetitive troubles with my digestion related aspects. So like sometimes it is loose motion, sometimes it is acidity, or some tightness in the abdomen area, or I have general feeling of indigestion, like that. This used to happen for the last 3-4 years. Maybe once in a month, once in a quarter, like that. The frequency and the intensity used to vary. Sometimes it was not too much of an issue. In the morning it used to have one or two times some loose motion, and later on it used to subside. So I didn't go. I used to ignore that because it used to happen frequently, and I thought it is some issue related to my sedentary lifestyle. Actually, I'm not a very outgoing person. I prefer to not go out, and I'm not a very active person in that sense. And even though my diet is good, I don't eat outside food much. I prefer home food only. But my timings are a little, used to be a little delayed. So, like, I used to have breakfast at 11, 12, like that, and lunch at 4 p.m. So it was not a very active kind of a lifestyle. So now recently what happened is, in November, that is 2 months ago, I again had this bout of tightness in my stomach and a lot of pain. Now I initially didn't go to didn't go to doctor or anything, because I thought it was just a normal kind of thing which I have regularly. But the pain got increasing. For about 6 hours, the pain continuously got increased. And later on, I was not even able to pass my stool, nor any gas, and not able to consume anything. I tried to drink something and vomit it out, but even that didn't work. So eventually I had to, the pain was unbearable at that point. So I had to go to the hospital, got admitted over there, and their initial x-rays, they showed a lot of gas in the abdomen area. He showed me the x-ray also. And the next, I was put on, I was not told not to eat or drink anything at that time. And the next day, the CT scans were conducted. They showed that there was some inflammation in the intestine. Doctor, should I share some reports or something with you that I have?
Later.
Okay. So the inflammation was indicated in the scans. Thereafter, I was put on a liquid. I was told not to eat or drink anything for the next couple of days for initial part. Then the diet was gradually brought to the normal level. The next week, I underwent colonoscopy because of this repeated issues that I pointed out that I have been having for the last 2-3 years. In that, basically, what the gastroenterologist told was there was ulcers. Basically the colonoscopy indicated that.
This is how the individual at the initial stage will tell you all the story that he has gone through. For him, the issue is all about his chief complaints. The issue is all about his stomach and bowel issues. That is, used to have loose motions and used to have pain and all these things. So, in some cases, we need to allow for the person to tell. The reason behind it is because we can get the location, sensation, modality concomitants in these type of cases. In case if the case doesn't go further, then at least based on the initial data about location, sensation, modality, concomitant, we can at least repertorize and give them the remedy.
Subsequently, it was given for the stool test and biopsy. They indicated that basically the reports suggested that there was some bacterial infection or IBD, that is, I think, inflammatory bowel disease. So eventually he diagnosed it as Crohn's disease, and currently I'm under medication for that only. But the thing is, actually, I'll be frank with you because I'm very pessimistic about what this particular diagnosis has been. Because I'm not supposed to go through the internet for finding out the details of the disease, because that creates a negative mindset amongst the patients. But because what I found was basically it was usually happens to those who smoke or drink like that. But I don't smoke or drink. I'm not even in non-veg or anything. I am actually a very I usually worry a lot. Even for trivial petty things,
I usually worry a lot for trivial petty things. Now, worry, stress, tension, these are all dynamic words. A couple of weeks back, I did a webinar on dynamic words. For example, like love. For example, like worry, stress, I don't have the freedom. All these are dynamic words because they do not have anything called as length into breadth into height into width into weight or anything. That is, you can ask this word and you see beautifully that word can take you to wonderful place of individualization. Because freedom, for example, can be anything. Similarly, the stress, you do not know what is stress. That's a common word. Tension, I have got a lot of tension. What tension do you have? How will we come to know? So therefore, they become an opening door into that path of individualization.
Sometimes I worry about that a lot and takes a lot of tension for that. So that has been one of my factors towards my with respect to my childhood. Basically, I've been very shy. Shy and introvert kind of a person. I don't usually mingle with people too much. I have very limited friends. Even now, I'm not very
shy, introverted with limited friends. This is this particular person's personality.
Outgoing and interacting. I'm not very good at interacting with people. I usually prefer being at home and staying with the family. That's what I usually prefer.
This is a character which is within the four walls, not outside the four walls. This is a person who will be with few family members type of person, introverted, shy, within the four walls, family oriented person. Unlike some who would be not at home at all, they would always prefer to be with outside with friends and with relatives or with anybody, with their colleagues and all that thing, right?
Then I'm very
what
good
I
at
do, step one, I try to find out what type of a personality is this person. Just general outline. I will not fix it. I will not endorse it that this is what it is. No, this is what it looks like. That this is the person who is shy. This is the person who is introvert. This is the person who is family oriented. This is the person who has got very few friends, and within the four walls is his life.
Studies have been having. Having a very sharp
So
mind.
memory
That's
is good. Memory is good. Sharp mind is this. I have a good memory. Sharp mind I am.
Right since my childhood, and I've been, I used to like subjects like maths, science. These are all my favorite and high scoring subjects.
Mathematics apt for, science apt for. These are the subjects that he would be very good at, and high scoring subject this way for him.
And even even after later on, like whenever there were competitive exams, whenever we from the SSC, HSC, and thereafter, even for the graduation and post graduation exams, all of them I've been very good at them. I've been one of the toppers in all of them. But as far as the interactions go, like I find myself wanting in where I have to interact with people. I have to make social engagements with them, and have a proper network of people so that I can that makes life easier. But I find very difficult doing all those things. Even now, when I have to attend some meetings, in the some office related meetings or something, I find sometimes if there are like the concerned people are different from whom I usually interact, I find it sometimes difficult to get connected to them immediately. So that sometimes makes me a little what you can say, I'm not able to speak out freely in such situations. Then the main reason is my confidence level is very low. Whenever a situation comes where I have to, I don't anticipate previously. I immediately lose my confidence at that point. I don't know what exactly to do. Like I get nervous at that point. I start scratching my skin beside my fingernails. I find difficult speaking also at that point. So these are some of the traits that I can think of. My parents are very supportive. Like they've always been. They have never forced me to do anything. They're very like liberal kind of parents. They never force me to do anything, or they never ask. Like they never tell me that this thing is to be done like that. I'm always taken my decision on my own, so that I've always had that freedom and that kind of a relationship with my parents. And I prefer doing things in a perfect way. Like whatever things are there, I don't like to just do it just because of the just for the sake of doing it. I prefer doing it and completing it in a proper way.
Again, the idea about doing things in a very perfect manner. I want to do it in a very perfect way. So it is not something that is hanky-panky. So we have got one more quality over there. Along with shy, along with being within the four walls, family oriented, do not have many friends, and good in mathematics, good in science. Along with that, another aspect is that I want to do things in a very perfect way, in a very proper way.
But if I find things are not in where they are supposed to be or how they are supposed to be done, I get irritated a lot. I find myself, as I said, I'm low on confidence right since childhood. So because of that, my productivity also gets affected. What exactly?
What sort of worries?
Worry. I usually I have worries with respect to the past as well as the future. So, for example, if I've had any conversation which with anybody, I mean, my mother or father or whoever, I mean, I usually start analyzing that whatever conversation has happened. If it is not pleasant, I mean, for some reason, I start analyzing what has happened, and I mean, would that conversation have created any kind of negative impression on that person about me? I mean, I try to overanalyze things. So I mean, that leads to me thinking that maybe I have not acted in a particular way. I mean, I have not done what he was expecting out of me. I mean, uh, just analyzing whatever discussions I have had with that person, or whatever has occurred with that person in the recent past. Now, this was about the past. I also worry about. I mean, I don't have anything to worry about my finances or anything.
So then what's the worry? So then what's the worry
I
about?
don't have any worry about finances. This is how they will initially tell you. They'll not come to the point. And nobody will come to the point. I can understand it. Because nobody would love to reveal their inner feeling to an unknown person for the first time. Unless until you know that person. So this is going to be one of the common factor. They will not tell you what needs to be told. Many a time they will, yeah, life is like that only. Everybody have problems. So that's okay. But how to ask and how to explore is a real important aspect. So therefore I ask him again, so what is the worry about then? If finance is not the worry, then what is the worry?
Worry means I usually fear that will I be able to live up to the expectations. It's currently a situation where we are trying to find out house to purchase in Mumbai. I mean, my wife wants to settle in Mumbai, but I had a right since childhood. I wanted to settle in Nagpur. That is my birthplace. So, and the parents actually they also want me to settle
Now
in
see,
Nagpur. So
this is the issue. My wife wants to settle in Mumbai. My parents are in Nagpur and they want me to settle in Nagpur. So there's a conflict of interest over here between the wife on one side and the parents on the other side.
Find myself in this situation where I mean I don't know exactly what to do. I mean I'm perfectly comfortable with both the locations. I don't have any issues with that. But I find
I'm perfectly okay with both the places. I don't have any problem. This is called compromise. And today, in today's world, the more we compromise, the more we compensate, the deeper the pathology. And this is what he has been doing throughout his life. Compromise, compromise, compromise. For everything, compromise. And therefore, the soul has compensated with the situations in life. And the more it compensates, the more we try to live according to the norms of the society or according to the norms of whatever the area, the place in which we are, the more the stressful situation we are in. And that is what art of living and all these things are teaching us. Live the life the way you feel, the way you are enjoying or the way you want to enjoy.
Myself, I mean, how to satisfy
This
both
is the idea. Satisfying both. What about your soul satisfaction? Your soul is compromising in order to satisfy the soul from both the sides, the mother and father on one side and the wife on the other side.
I mean, my wife as well as my parents. I mean, but I find difficult to please everybody. I mean, judgment. I mean, decision making is something that I have lacked for quite a long time.
In decision making ability. So I'm not able to decide. Now this is another dynamic word. Not able to decide. Decide what? About what? On what issues? On what subject? We do not know. And therefore, this is a broad covering. I'm not able to decide. But what is the thing that you're not able to decide is important to understand.
Period. I mean, I'm not able to decide on things quickly.
Decision making, what you said?
I mean, I'm not very good at quick at decision making. So as I said, I analyze a lot. I mean, overanalyze most of the time. So now, because of this analysis, I think about things that are not even existent. So
decisions like
that is
situations where I have
like What sort of decisions? I need to know that. Decisions like what?
Multiple options, like and options which are not very straightforward. Like there is some pros and cons of both the.
So, how does it feel in that moment? It feels like what when you're not able to decide?
I find it very confusing. I don't know what to do. If I repeatedly I have exposed to that situation for a long period, I find it difficult breathing also sometimes because I mean I don't know how to face that situation. So I usually don't respond whenever I have this situation. I usually don't respond to the people. I just keep quiet. My hands start feeling a little cold at that time because, as I said, I have this habit. Whenever I'm nervous, I scratch the skin near my fingernails. I face these nervous situations during this period.
Nervous situations. 1, 2, 3 incidences.
One thing that I regularly face, see, whenever I have to.
Give me examples, 1, 2, 3 examples when you get nervous. Because there will be a common thread from all the 3 or 4 examples that the person gives, a common thread that you can see. Which type of situation, what makes him nervous, and then finally, what is the experience in that moment of time.
For example, call customer care people for any complaints or issues that I'm facing. I mean, genuine issues. I'm not talking about, I mean, some issues like with respect to the service or anything. Even though I know that I've not received that service. So while arguing with the customer care, I start trembling, and I mean whenever I get into an argument mode, I mean whether it is with some third party people or with my maybe sometimes in quarrels with my own wife, I start trembling in voice. I mean words don't come out of my voice. Come out of my mouth.
This is what I say is the effect of that situation. Trembling of voice. Word doesn't come out from my mouth.
What to speak? I sometimes speak blabber anything. I mean. Some insensible things, and because my mind is not in a proper position at that time. I'm not able to speak clearly. I'm not able to think clearly. Again, when I have some meetings or anything, see, even if I'm prepared for my office meetings or anything, I always have some feeling that I have not. I'm not I'm not completely well versed with what I'm supposed to present or what I'm supposed to discuss. So during these meetings, I always find it difficult to concentrate on what exactly I'm supposed to discuss or meet. So what happens is most of the times I miss out on some of the key discussions that are happening during the meeting. So I usually keep my recordings on my call recordings as well as the video recordings if at all it is available. So I mean because of this situation of me getting nervous, I'm not able to concentrate on the discussions that are happening in the meeting during.
What happens at that time?
Even though I know that I'm prepared for the meeting, I start feeling nervous. I mean,
so in that moment of nervousness, what happens?
What is important to understand. Nervous, okay, I can understand. Many of them get nervous. All get nervous. In fact, in that nervousness, what exactly happens to you? On your hand, legs, back, body, chest, shoulder. What is the experience that is happening?
Frankly speaking, my mind goes totally blank at during some of these points. Again, that same traits happen. I mean, the scratching the fingernails, me feeling slightly cold with my feet, and I mean, I totally find myself blank at that point. I don't know.
Describe blank.
Even though that domain is belonging to me only. I mean, where I'm supposed to work and provide the solution, but I mean that same thing I'm not able to recollect and tell to that person.
Describe blank. Just the word blank.
Vacant. There's nothing around me.
That's vacant.
Completely black, dark.
What's the experience in that moment of time, mentally, physically? Blank, vacant, black, dark.
My feet, I mean, my palms and feet start getting cold. I also shake my legs.
So, for example, if a child has to suffer like this, when will the child suffer? Any situation if you can create.
Okay, see, I'll bring my own case. Like in my childhood, as I said, I have been a very shy and introvert person. But my father always wanted me to engage with others and play outside and represent school in different activities. So he used to push me to participate in different activities in the school. We used to have morning shlokas and all, where each day some student has to recite them in front of the entire audience. I mean, the entire school audience. So that was an auditorium. So I mean, but I used to very I was very nervous in those situations. Most that the thing that I had to recite was very less. I mean, it's not that I had to recite a long thing or something, and I was good at English also. So it's not that I had trouble speaking English and all. But I found myself in similar situations that at that point also. I find very difficult to face people. I mean, I'm not able to recollect what I've thought. Even
not able to recollect meaning.
As I said, I'm not able to think clearly. I mean, even if I have I've made it by heart many times by reciting at home. I don't recollect those words.
I have made it by heart by reciting many times at home. That is the way how he was telling that I would like to be perfect in a proper way. And here is giving you the idea about this particular recitation, that I'll recite it by heart many times at home.
At all.
Physically, what is happening?
I tremble. The legs start becoming the main trouble that I face it with my speech at that point.
What is the cause for all this thing? If you have to put it in one line.
My lack of confidence is the main thing that happens.
One. What else?
I fear failure. I mean,
what will happen? Just go one step ahead.
The eventual thing that I think of is they will have a negative impression about me, which will last forever.
Will give you one sentence. You have to take them one step ahead, one step ahead, one step ahead. And then you see how it percolates down the exact experience of that nervousness in that situation.
And
negative impression meaning what?
They had some kind of an expectation out of me which I couldn't deliver.
Impression means what?
As I said, I'm a very perfectionist kind of a person. I mean, I used to
come back to the word. I'm a very perfectionist person. And impression making.
Like to do things correctly and properly. But if I fail in such situations, that image of mine will get destroyed.
Image of mine will get destroyed. And that is the cause of nervousness. That I should not do anything wrong, I should not fail, or else my image will get destroyed.
That kind of feeling I have. I mean, if I go down, I find it difficult getting up. So, I mean, in any of the things, I mean, whether it be confidence or whatever whatever things I lack in, I find it difficult accepting things sometimes.
How was your memory during childhood and all? In school and everything?
Yeah, memory was good. See, memory in the sense that I'm always good at remembering numbers and I'm very fond of maths. I have said. I mean, I'm very good at that. So numbers and I'm very good at analytic thinking also. So those things I've been very good at that.
Any habits as a child for nail biting or something of that sort?
No, nail biting, I don't have any habit, but I scratch the skin beside my fingers.
You peel the skin off?
Yeah, the skin just beside my fingernail.
So you see how slowly, gradually the person opens up and one step ahead, one step ahead, one step ahead, because people have never ever traveled that path of experience. People have always lived at emotional level. Most of us live at emotional level. But how to take them beyond that emotional level to find out what exactly is happening, that is important. Right? So we'll see the follow-up of this case.
So basically, sir, now almost have happened that we have stopped the medicine.
Yeah.
So how things are like?
From the point of view of my illness, I used to have all the stomach related ailments. the hospitalization that eventually I had to go through. Every month I used to have some kind of troubles, like in some one form or the other, either loose motions, acidity, or indigestion. I mean, from the day I have started taking the medication, I haven't had a single day of having had these loose motions. So I mean, I don't have any troubles anymore. And from the point of view of other things, like my own, the way I was looking at things and not able to concentrate. I mean, because of these health conditions, I was not able to give my 100% anything. I mean, even at work, I used to feel very tired and not able to concentrate. And I used to get nervous at every small things. Eventually, I mean, when I was undergoing these getting medications, maybe about 2 to 3 months down the line, I started finding the results to be very positive. In the sense that I was able to handle my day-to-day activities better, able to concentrate better. I didn't have those kind of breakdowns. I mean, as someone who has never taken homeopathy medicines, I mean, always I used to either go for allopathy or Ayurvedic. I mean, obviously up till that point of time. So initially, I was a bit skeptical about undergoing homeopathic, because I was initially under the impression that homeopathy is very slow to react. I mean, that was the kind of impression that I had initially. At this point of time, when having undergone this entire period of treatment, I mean, I am sure that future, if at all I have any such occurrence of any other disease or anything, I'll surely go for homeopathy. And especially once I started having interactions with Dr. Shekhar, I mean, the very feeling of talking with him gives a lot of inspiration because of the way he speaks. I mean, the way he counsels, and that definitely provides a lot of motivation and inspiration.
So thank you very much, sir. And we will be in touch. If anything is there, let us.
So his complete Crohn's disease was gone, completely treated. And the remedy given to him was silicate, 200 potency. I'll show you the rubrics taken for his. So these are all the rubrics that were taken for his particular case. Intestine cramping pain, intestine distension from flatus, abdomen inflammation, colon colitis, mind indecision, irresolution, mind confidence lacking, no self-esteem, public speaking with, mind confidence lacking, no self-esteem, future feels himself a, mind confidence lacking, no self-esteem, anxiety, performance with, anticipation, general ailments from, fears, phobias, general failure of, undertakings, general nothing, list he fail. Feet cold, feet icy cold, hand coldness, hand icy, mind timid, public about appearing in, mathematics general ability for. And if you limit that to Crohn's disease, you see again silica is also there with along with fluoric acid and muriatic acid. And all these rubrics are taken along with the case history sheet that we give to the patient before the appointment. So that they can write down whatever, so that they don't forget anything to write about themselves. So this was what the entire case was. Any questions?
Sir, this is Dr. Archana. Very nice session you're having. I had a small question that we have to see the thermals also, because sometimes we see that in Mumbai or in Kolkata, patient is generally hot, and Salisha is known to be a chilly patient. So how much importance you give to the thermals and potency?
See, frankly speaking, in today's world, if you go to see with this global warming, all of them will say, I don't like this thing, summer weather. So how much we can really rely on that, unless or until if the person really comes up with extraordinary expressions of it, that I can't tolerate even the fan, yeah, then I can understand. But on a very natural note, many of them wouldn't like summer season or hot season or anything of that sort. Na?
Okay, sir.
And
Thank you,
especially
sir.
with places like Bombay, so it is very difficult to find a person like that.
Yes, sir.
Any other questions? So
Sir,
basic
good
idea.
evening, sir.
Yes, yes.
Myself, Manikanta, sir.
Yeah,
I have a
Manikanta.
small question. You had asked the patient if a child feels like this.
If
Why
you change
the child? If a
child,
child, what made you to ask the child, sir? There?
See, basically the idea was about that as a child, when you get the understanding, faint idea about the remedy, you know what age group the remedy belongs to. And therefore, then I immediately go to that level in some cases where I know that, suppose now this was the row 3 wala understanding that could be seen. And row 3 more or less is that childhood age. So therefore, I asked during childhood, have you ever gone through, or as a child, any child will go through that, and then immediately connected to his childhood.
It comes with the experience. With the experience you asked the things, sir.
Yeah, I mean the remedy belonging to mineral kingdom was there because see, stepwise I started telling you that they are introvert, that he has very less friends. He is within the family oriented person. He is shy. He is good in mathematics. This much also rubrics you put, and Crohn's disease. You see, so you start seeing some remedies coming up, right?
Yes, sir.
And the idea of being perfect. And further, he said, I used to by heart it so many times. This only silica can do, because for them, image is very important. The sense of embarrassment is very important. Whereas carcinosin will not have this. The carcinosin's protection, the perfection is towards the idea that if I do not be perfect, then it will be chaos. So therefore, carcinosins need to keep things properly, orderly, perfectly, is because it should not be chaotic. Everything will go haywire. Everything will be destroyed and finished. And the idea of love for animals in carcinosin, the idea of love for nature in carcinosin, playful, all these things are not there in this person.
Yes, sir. Thank you. Thanks a lot, sir.
Thank you.
Doctor, good evening.
Good evening.
It's Ashok here. I have simple question, although everything is explained very well, according to your answer to other doctors also. If we look at the chart of that you have shown, the first remedy is silica and second remedy is lycopodium. And with lycopodium, all majority symptoms are covered, but the totality of these two remedies are 31 and 35. Means the covered symptoms are 13 and 14 of silica, but the totality, if we look up at reality, is 35. Why, in case I myself put in these situations to give the medicines, what you have valued, fantastic, cure was done, no doubt. Still, I need to ask 35 considerations and 31 totality of silica. Why did you consider, and why I myself should not think about lycopodium according to this his type of perfection, he have told about that. He's doing very perfect things, intellectual things, everything. And this lycopodium and the modality of that lady doctor told about that. Why I myself being Ashok as a should not have think about lycopodium. Please, doctor.
Very good, sir. Very good. See, the question is very genuine. Even I would have asked myself, why not lycopodium? But if you see down the second chart that I showed with 3 remedies over there, fluoric acid, muriatic acid, and silica, which covers his perfect disease, Crohn's disease,
Yes.
which gives you the icing on the cake, na? Because only 3 remedies are covering Crohn's disease, that is fluoric acid, muriatic acid, and silica. And whereas silica is also given showing in the main chart also. So
Yes.
then pathology also covers, so it makes it more stronger.
Okay.
Which lycopodium doesn't cover.
That's right. Yeah, that's right.
So therefore, that gives you the additional help when you're filtering it out for the pathology also, and if the remedy is seen there, whereas other one which is covering all the this thing rubrics and the symptoms, but if the pathology is covering, then it gives an additional ace not to the entire case.
Certainly, doctor. Certainly. That's right. Thank you very much, really.
Thanks a
Really
million.
fantastic.
Thank you. Thank you.
Namaskar.
Over to you, Kavita. Niharika.
That's amazing, Dr. Shekhar. And I know we have more and more to speak. And if anyone wants to take opportunity to ask any more questions, please do so. And Niharika, anything in the chat?
Ma'am, someone has asked what was the potency and repetition in the
200
case.
potency, and it has been repeated 3 to 4 times in the entire year. And we have kept him on observation for 2 long years without medication to endorse that it is completely perfectly cleared.
Rest, everything has been covered, ma'am.
That is amazing. And Dr. Shekhar, Priyanka would like to say any upcoming events of.
Yes, I think she's there.
Oh, yes, Priyanka, go ahead.
Hi, ma'am.
Hello.
Thank you so much. It was a great platform, and connecting with a lot of homeopaths from various places. It always feels good. Just a small information for all our participants that we are having there are so many year-ending sales going on. So we are also keeping this mega sale for all the video lectures of Shekhar sir with 25% discount. There are total 10 courses on various subjects like salts, mammals, snakes, birds, kingdom differentiation, levels of experience. So any of you, if you are interested in getting these courses, which are a very good source of learning and they will be with you lifetime, it's a very good addition in your video library. So please take the opportunity and purchase these courses. Please contact us for the more details. Our number is 7588539531. I'm also typing our number in our chat box. And of course, YouTube channel is also there where we upload sir's lectures, our lectures every week, where you will get the opportunity to learn on various subjects, including case studies like one case we saw today. So you will keep learning and growing. So that's from my side, ma'am, and all the very best to all the participants. Thank you so much once again for the platform, ma'am.
Thank you, Dr. Priyanka. And we have super class, right? Dr. Shekhar is upcoming, and we have shared it in our newsletter too. So if they haven't registered, please take opportunity.
It's starting in the 23rd of December. It's a Gurukul workshop. We do these workshops 4 times a year in the March, May, September, and December. So up next workshop will be in the March 2026. So those who want to get into the learning of Gurukul style in-person learning along with Dr. Shekhar sir and his team, then please join us. Again, the number will remain the same. You can get in touch with us and we will give you all the details about the workshop. And you will get the details in Kavita ma'am's website also. She's so kind enough to provide the place so that the information reaches to maximum crowd. Thank you so much, ma'am. Once again, God bless you.
Thank you so much, Dr. Priyanka.
Kavita ma'am, thanks a million, and also Niharika for coordinating. Thank you so much.
And it was wonderful.
Next year we will definitely do a couple of more this thing on this particular case taking, so that the idea of case taking where people are struggling, not about the remedy, it's not our materia medica, but the art of communication and the skills and the tools that we use to understand another human being being human being.
Yes, definitely. And I would love to come one day to Gurukul also to experience that, all that where you get connected. And so we would like to take privilege to honor your gracious presence and for your precious time in sharing knowledge and wisdom at our study group, Dr. Shekhar, with our caste certificate. Niharika, please can you share and kindly accept it from our team?
Thank you.
Thank you so much. And
Thanks a million.
just before we wrap up, and we'll just take a little bit 1 minute to announce the upcoming events. So we do have the meditation sessions also monthly once, Ka Miraculous Minds, as a part of my spiritual journey started. So do attend it. And just yesterday we had with Dina Mariam on Untold Story of Sita, where several myths which were lost, they have been revealed. It's a wonderful, and I know a couple of you have already read that book. And the next session we have in January 25th at 9 p.m. with Dr. Ajit Kulkarni on topic Freud's concept of the ID, ego, and superego, and its integration with homeopathy. So we have many more renowned homeopaths. They are lined up for KHA webinars. Please stay tuned to the website and social media. And sincerely thank our homeopathy study group team for the continuous selfless support. Many of have joined today. Almost all the doctors, Dr. Rajneesh, Dr. Richa, Dr. Archana, and many more, Dr. Deepa, in case if I have missed anyone. And so thank you so much, Dr. Shekhar, once again. And I know you're running late and you have spent your precious time here sharing this knowledge, and no one should miss his classes. That's what I would say in one word. It's great learning. And anything, Niharika, you want to say?
A big thanks to our speaker today and to you, Kavita ma'am. And for the upcoming webinars and information, everyone can follow us on our social media handles, Facebook, Instagram, and YouTube. Other recorded webinars can also be viewed at our YouTube channel, Kavita Kukunur. I'm thankful to all the KHA volunteers for their continuous support and selfless services with which we are able to organize such webinars in successful manner. For any other information, you can reach us at kstudygroup@gmail.com. Thank you so much.
Thank you, Niharika. And many have joined, in case if I miss anyone's name, and all the participants for your always continuous support and inspiration. Thank you all. And I think anything, Dr. Shekhar, shall we end the session or anything you wanted to say before we end? We are all, okay, I think muted, right? You're muted. Okay. Dr. Shekhar, you're muted. Anyway, yes. So thank you. Thank you so much. And Niharika, we will end the session.